Welcome back to our orthodontics learning podcast. In today's session, we're going to dig deep into two very important aspects of aligner therapy. First, the precautions and limitations we need to consider during aligner treatment, and second, the role of clear plastic retainers in preserving treatment results. These topics may seem separate, but they actually connect beautifully. One addresses what can go wrong during treatment, and the other focuses on how we hold on to the results we've worked so hard to achieve. So let's get started. Part 1. Precautions with aligner therapy. 1. Evidence and predictability. Let's begin with something we often forget. Despite the hype, aligner therapy is not backed by decades of solid randomized clinical trials in the same way fixed appliances are. We do have studies, but many are small, short-term, and sometimes industry-funded. What does that mean? It means we must be cautious in assuming that what works in a digital plan will always work in the patient's mouth. For example, ClinCheck may show perfect torque control on an upper incisor, but clinically, that torque correction might be underexpressed by 30 or 40%. The aligner doesn't grip the tooth root the way a wire and bracket can, so we must anticipate these shortfalls. 2. Common underexpressed movements. So, which movements are most problematic? The literature highlights a few. Torque movements, especially of incisors. Intrusion, particularly for deep bite cases. Rotation of rounded teeth, like canines or premolars. Root uprighting after extraction space closure. Each of these tends to be less predictable with aligners compared to braces. And here's the kicker. The more complex the case, the less predictable the outcome if we rely on aligners alone. 3. Importance of overcorrection. That's why we use overcorrections. Think of it like aiming slightly above your target to hit the bullseye. If you want 10 degrees of torque, you might program 15. If you want a rotation corrected fully, you might over-rotate in the plan. These compensations are not cheating. They are evidence-based ways to counter the aligner's inherent limitations. 4. Four-dimensional restrictions. Another concept I want you to grasp is what Eliades describes as the four-dimensional restrictions of aligners. These are tooth length. Very long teeth don't track as well. Tooth width, large, wide teeth are harder to rotate or intrude. Vertical dimension, extrusions are notoriously unreliable. Timing, moving too many teeth at once reduces predictability. If you ignore these, you'll face what's called tracking failure, where the aligner simply doesn't fit anymore because the teeth haven't followed the programmed path. 5. Patient cooperation. And then there's compliance. Aligners only work if they're worn 20-22 hours per day. Patients who cheat even a few hours daily reduce the biological force duration, and tooth movement stalls. Compliance is the invisible variable that no ClinCheck software can measure. That's why many orthodontists still combine aligners with elastics, TADs, or sectional fixed appliances when absolute control is needed. 6. Clinical pitfalls. So, what are the common mistakes? Relying blindly on the default ClinCheck staging, failing to add overcorrections, doing too much IPR without proper anchorage, ignoring the role of attachments. Each of these can lead to refinements, longer treatment, or even patient dissatisfaction. Part 2. Clear plastic retainers. 1. Historical context. Now let's shift gears. Once we've achieved a result, how do we keep it? Retention is critical. And here, clear plastic retainers, sometimes called Essex or vacuum-formed retainers, come into play. These have actually been around for over 50 years. In many countries, they're now more popular than Hawley retainers, especially for upper arches. 2. Materials and properties. There are several plastics used. Polyethylene, stiff, transparent, durable. Polypropylene, more flexible, easier to wear. Polyurethane, the material used in high-end brands like Vivera, stronger, more stain-resistant. Each has pros and cons. For example, polyethylene may last longer but feels harder on the teeth. Polypropylene feels gentler but can deform more quickly. 3. Effectiveness versus Hawleys. How do they compare to Hawleys? Studies show that in the upper arch, clear retainers are equally effective. In some cases, especially for lower anterior alignment, they may even be slightly superior in the short term. Compared to fixed bonded retainers, they are equally effective in the upper, but less so in the lower, where fixed wires give stronger control. 4. Wear protocols. What about wear schedules? Most clinicians recommend night-only wear after the initial stabilization period. The evidence suggests that night-only wear is just as effective as full-time wear for long-term stability, provided patients are consistent. 5. Longevity and risks. Here's the problem. Clear retainers don't last forever. They can crack, wear down, or become cloudy. Some last 6 months, others 2 years, depending on the material and the patient's habits. Hygiene is another issue. If patients drink soda or sugary drinks with retainers in, the retainer traps the liquid against the enamel, a recipe for demineralization. And if not cleaned properly, bacterial buildup can be significant. 6. Patient preference. But despite these issues, patients consistently report preferring clear retainers. Why? They're invisible, comfortable, and don't affect speech as much as Hollies. For young adults especially, aesthetics drives compliance. This is one of those cases where patient satisfaction often outweighs the minor clinical disadvantages. Conclusion. So, to wrap up, during aligner treatment, we must plan carefully, use overcorrections, and respect biological limits. Patient compliance is non-negotiable. After treatment, clear retainers remain one of the most practical, aesthetic, and accepted ways to maintain results. But they need regular replacement and proper hygiene. Aligner therapy is not magic. It is a tool that only works well in the hands of a clinician who understands its strengths and weaknesses. And that's the art and science of orthodontics.